Thank you for calling the AETNA concierge team for MTA New York City Transit. This call is being recorded for quality and other healthcare operations purposes.
So is this one.
If you're calling regarding your Medicare Advantage account with MTA, press 2. For future calls to Medicare Advantage for MTA retirees, dial 877-603-2058. Please make a note of that number. If you remain on the line, you will be transferred to 877-603-2058. Please hold while I transfer your call.
Did they put the wrong
Thank
number on the damn
the
slide?
AETNA Medicare Advantage Member Services Team for MTA New York City Transit retirees. This call is being recorded for quality and other healthcare operations purposes. Enter or say the month, day, and year of the date of birth of the person you're calling about. We've identified you from the phone number you've previously provided to us. Lloyd. Correct?
Yes.
For all other questions, say representative.
Representative.
Again,
Representative.
please hold while I transfer your call.
Good afternoon. Thank you for calling. My name is Derek. Am I speaking to the member?
Yes, you are.
And let's see here. Looks like your information came through. Give me one moment.
Okay.
How may I help you?
Okay, Derek. I'm quite concerned about a letter that I received from you guys. My doctor is in New York Presbyterian, and from my understanding, after April 1st, she will be out of network. So my union has put up a flyer, right? And sent it out as an email. Can you answer a question for me? What is continuity of care plan? What does that mean?
So that form allows you to continue to see that provider, and we will pay them as in-network. So so even though they're leaving the network, that allows you to keep seeing that provider without consequences.
For how long?
With the continuity care, it is up to 1 year.
The letter says that I have to apply for it? So the letter actually says that I have to apply for continuity of care, huh? Derek?
Correct. It's a form you have to fill out and send in.
Okay, wait a minute. Let me look. I'm looking at the letter here. How to continue care active treatment of chronic illness. Okay, I have the letter, but there is no form attached to it.
Okay. I can have that form sent out to you.
Okay, what about the rest of the okay. Okay. All right. I would appreciate it if you did.
Let me see here. And that they're out of nowhere as of April 1st, you said, correct?
Yes, that's what the letter says.
Okay. All right, one moment.
And it does say certain care, not all care. Certain. Yeah, it says certain ongoing medical treatments will be covered at the preferred level of benefit. Certain. What is certain? Not everything.
All right, yes, sir. So I'll get that form sent out to you. That way you can fill it out and send that back to us.
Okay, I have another question for you. On this flyer that you guys have put out, it says certain care will be continued. It's not specific. Can you tell me what they mean by certain care? Is it like if I have a cancer or something like that, or I need a surgery, an emergency surgery or something like that? That's very, very vague, certain care.
Yeah, so the continuity of care, that is for a member who is currently under the care of a particular doctor that they have to keep seeing. That's what it's for.
A specialist.
So like if it's just for a doctor that you just want to continue to see, that may not fall under the continuity of care, but that's why when you send it in, they will review that to see if it's like a needed doctor for you, is what they'll do.
So if I'm seeing a urologist, okay, and my urologist wants to continue to see me because my PSA numbers are high, or let's say my prostate is enlarged, they would determine whether I can continue seeing this doctor?
Correct.
Wow. Okay. Does that go for a cardiologist too that has been treating me for a heart condition?
Yes, that would go for any provider. You can just send it in, and basically what it'll do is you'll put like the doctor's name, you'll put what like why you have to see that doctor. So like, well, for your cardiologist, you would say, I have a heart condition, this happened, I've been seeing this doctor, she helps me with this. That's what that form is for.
Okay.
Is for you to tell us why you need to see that doctor.
Okay. What about if this doctor is now what about if this doctor I've been seeing with New York Presbyterian, she's my PCP, and her name is on the letter that you sent me that I won't be able to see after April 1st. So I can no longer see her as my PCP. I have to find a PCP in network with New York Presbyterian.
Correct.
Let me ask you another question. If I decide I want to continue seeing her and I pay her as time goes on, will I get reimbursed?
You can submit that to AETNA and we will reimburse you. Yes, sir.
You will reimburse me if I at what you guys are allowed to reimburse.
Correct.
Hmm.
And that would go for any doctor you see. So if there's any doctor you want to continue seeing at New York Presbyterian, but they won't bill us, you can always pay the bill up front and submit for reimbursement. That's not just for your primary care doctor. That would be for any doctor.
All right. Yeah, that's the same thing as an out-of-network doctor. I had another question that I wanted to ask you. Yeah, just one more question. Can I get a copy of that transition to care policy so that I can have it for my records?
Yes, sir. We'll send it out to you. Yes, sir.
Okay. All right. Basically, yeah, how long is the review process? Do you know?
As far as the review process, I don't know exactly how long it takes, but typically within 30 days, we have that reviewed, if not sooner.
Okay. All right. So how long you think before I get that application in? Well, I get the application.
You when we send this out, you should get that within 8 to 10 days.
Okay. Okay.
Honey, can you ask him a question?
Oh, my wife wants to ask a question. She's on the line. She's listening to me because she's more concerned. And wives, they think we don't retain things too much. So can you just answer a question for her, please?
Yes, sir, I can.
All right. Go ahead. You can ask, dear.
Thank you, honey. So if we have to pay for the doctor and does that get covered in our out-of-pocket cap maximum?
And say that last part, I'm sorry.
That if we have to end up paying for the doctor because they're out of network, and does anything that we have to pay that doesn't get reimbursed by you get covered under that out-of-pocket maximum?
What's the Medicare, whatever we reimburse, yes, that amount is what gets applied to your max out of pocket. Yes, ma'am.
As an out-of-network doctor?
Correct. Because this is an extended service area PPO, so even though they're out of network, you're still covered. It would still go to your max out of pocket.
Okay, because that's not what we were told when we called the last time about a regular out-of-network doctor. What is that? What makes this different? Is this more special?
What were you told last time? I'm not understanding.
Well, if this doctor is considered out of network and they're not accepting the plan for payment, then I'm out of network. I still have to send the bill to you to get reimbursed, right?
Correct.
So whatever doesn't get reimbursed by you, does that amount get covered under the maximum out of pocket?
No, only the amount that we're going to reimburse you.
Only the amount. Say that again.
He said,
Right. Only the amount that we would reimburse. So let's say you send in a claim for that was $150, but the reimbursement amount is only $100. So that $100 is what would be applied to your max out of pocket, not the full $150. Just the amount that we're going to reimburse, because that's what's being covered.
So why would the 100 fall under there if you're actually reimbursing it? Because then that's technically not an out of pocket.
Because you still paid it, you're still covered for that, so that still gets applied.
That's interesting. So then the other 50 would be purely out of pocket, but that wouldn't be covered.
Correct.
That's
Yeah,
crazy.
it's only going to be the amount that's actually being covered, and that's what's being reimbursed to you.
So any out-of-network doctor that for any amount that you reimburse gets covered under the maximum out-of-pocket.
Correct.
Then what happens when we reach the maximum?
When you reach the max out of pocket for the year, any Medicare covered service, there's no copay. Now, if you have to submit a reimbursement for those particular doctors, it may not work that way because we're still going to reimburse you at the same rate. That wouldn't change how we reimburse.
So on my husband's plan, what is the maximum?
Let's see here. The max out of pocket.
You're on the option 2, right, dear?
option 1.
Option 1.
Let's see here. Max out of pocket. Just waiting for it to come up here. Let me see. pull that up real quick here. And you said option 1?
Yes.
Okay. Let's see here. Actually, this plan actually doesn't have a max out of pocket or a deductible.
Option 1 doesn't have a max out of pocket or deductible?
Correct. It shows 0 for the MTA option 1. No deductible, no max out of pocket.
So you be paying forever. Did I get that straight?
Yeah, so the max out of pocket doesn't come into play.
Oh my gosh.
So,
So we be paying, honey.
wow. Okay.
Glad
Okay.
we asked
Yeah,
that question.
so whether it's February or December, you would be reimbursed at the same rate no matter what.
But we be paying no matter what.
Since this plan has no max out of pocket, correct.
So we'll be paying, if I go see her, I gotta pay regardless. If I go see a specialist that's out of network, I'll be paying them. They won't accept the coverage and I'll be lucky.
Correct.
And if whatever's allowed for me to get reimbursed from this specialist is what I get.
Correct.
Holy cow.
Okay.
You have any other
Derek-
questions, honey? I'll be quiet now.
No, Derek, you've been very patient with us, and because we know we're kind of confused with this new coverage that we were weaseled into, or we were given. But I appreciate your time. You have a great day. I'll be looking forward to getting that application in the mail.
Yes, sir.
All right, you have a great day.
You as well. Thank you.
So am I listening to this shit right? If I go see this urologist and he says I got to give him $2,000, I got to give him $2,000, and whatever the max they allow, they'll reimburse me. So
you have no max though, so like so you have to wait and see what they decide what they want to reimburse you with.
That's what I was just saying.
Oh no. Wow.
No, this shit is enhanced, bro.
This is the enhanced. And mind you, you didn't even get the application with your letter.
Right. And everybody
you didn't even know.
Right. And everybody that got this letter that was at that meeting with us yesterday, they didn't get the application.
They don't even know that they're supposed to get an application to file for this extended coverage thing. I don't even think they know.
Marianne,
$0. It is $0. It is a $0 out-of-pocket maximum.
Mm.
And it's 1,000 on option 2.
That's their reimbursement is 1,000.
No, that's and this guy's wrong. Why would that be included in your out-of-pocket maximums is supposed to be what is out of your pocket, not what's out of theirs. That was such a stupid answer.
Well, we got him on record saying it. Derek is on record. So he really didn't answer the questions that we really was looking for. Wow.
As
So
of
now we got to make sure that everybody gets, if they got this letter, that they have to have that application if they want to continue seeing a doctor in New York Presbyterian, so that they can approve or disapprove if you can see this doctor or not. Because that's all the application is. That's what he said.
So you got to tell them they need 8 to 10 days to get the application, then up to 30 days for them to find out if they're approved or not, for them to continue the coverage.
Wow.
It sounds like
now this shit is making me nervous because I'm seeing a specialist for my stomach and a urologist. I was using myself as an example. Gee. So that this is not helping me at all unless I had option 2.
Option 2 has $1,000 out-of-pocket maximum. $0 primary doctor copay, $5 for specialists. You pay more copays, it appears,
Option 2,
in,
yeah.
in
Yeah, you
option
do.
2.
Specialists, you got to pay a copay. Emergency rooms, yours is bigger. I don't know if it changed since we got into this Medicare Advantage, because I think it was just $15 with the old plan if you went to the emergency room. Specialist, I think, was $10. I don't know. That was option 2.
Why would he put the full reimbursement for Medicare B on option 2? You have only half, not even, you have like a third on option 1. You have more copays on option 2, right?
Yeah, and I think that's why they get the bigger reimbursement. They get a bigger reimbursement than option 1. That's how they sold them on the reimbursement. If you're single, you'll get $2,000. If you're married, you'll get a $4,000 check.
But see, that was supposed to be for your healthier people not to pay copays. You get the higher reimbursement. The more infirm people should have been taking option 1. But this is like what I said on page 8 of the contract. You must use in-network doctors or you will have to pay. You're on option 1, which was meant for the more infirm people. They want to keep you in the network so that you're not using out-of-network providers. No matter how long you're in this plan, you are going to find doctors that will repeatedly drop out of the Aetna network or hospitals dropping out of the Aetna network. You will always be paying in option. This is a horrible plan. This is absolutely horrible. You will always be losing your doctors. And you will end up having to pay if you insist on seeing your own doctors.
Yeah, that's what he just said that. And
so you can do that. I would encourage people to do the continuity of care form and let's start to see what they start doing.
Okay, I get Donovan to craft up a flyer. This is every time, every time you talk to these people, it seems it gets worse and worse. I guess the more you dig into it, the more bullshit that you find. And because these guys didn't listen to you, we all getting screwed.
So basically, in a nutshell, you have an option 1 and option 2. Option 2 is $1,000 out-of-pocket network option feature. Option 1 has no out-of-pocket maximum, which means you will always be spending. The out-of-pocket is supposed to work like this. You see a doctor that's out of network, you pay to see that doctor because the doctor won't accept the plan for payment. You then submit the bill to Aetna. Aetna determines what it will pay, if anything. If it pays nothing, then that doesn't get captured under the out-of-pocket maximum. They've already told us that, right? If they pay for part of that, they do approve it, then part of that does go under your out-of-pocket maximum. It goes towards that cap. Unless you're in option 1 and there is no cap, you will always be paying if you continually pay to see a doctor that refuses to take the plan for payment. So the key feature here is when you're seeing a doctor who's not in the network, you need to ask them, are you in network? The doctor says no. The second question must be, will you accept the plan for payment? If the answer is yes, you're okay to a point. But if the answer is no, this is where this becomes a problem. The doctor will not accept the Aetna Medicare Advantage PPO ESA plan for payment. You must pay the doctor. And then you must submit the bill to Aetna and hope that they reimburse you in finding it medically necessary. And remember too, because it's an out-of-network provider, you are strongly encouraged, according to the evidence of coverage, to contact Aetna and ask them for a pre-visit confirmation that they will approve to pay the visit, which still isn't a green light because they also have what they call retrospective reviews, and they can look at it afterwards and change their mind and tell you, sorry, I'm not reimbursing you, dude. Have a nice day. Yeah, all stuff you don't have to deal with in traditional Medicare.
Right.
And yes, because local local 100, TW local 100 leadership did not read the contract on the small print. They did not know this.
So Marianne, what happens if you don't apply for the extension?
If you don't apply for the continuity of care, you're
The
basically an
continuity.
out-of-network provider through the regular out-of-network doctor procedure. The continuity of care form is basically saying, I've been undergoing the treatment by this doctor for this, and I wish to continue the care. I think this would have to be for care, and we could have asked that question too, which we can ask on the, write that one down too, Lloyd. We could always ask on the follow-up phone call. We can always say, will you only cover care will you only cover care? What is the effective date of the care that you would cover? Is it the effective date of this plan, January 1, or because you guys have been on Aetna, does it go back? It's not like they're a new vendor. You've been in Aetna for the last several years. So they technically really shouldn't be denying you care because you've been in the Aetna network forever. You've
Right.
had no other vendors. But it would be interesting to find out, will they only consider continuity of care under their TOC policy, their transition of care policy starting January 1, or is it okay that from care from before, or would it be okay for a diagnosis after January 1?
And he also said that I would only be able to see that doctor, that specialist, for a year.
Yes. That to me is not continuity of
Oh,
care.
it's
That
not.
means
Once
you
your
got
year
1
is
year.
up, if you still sick, you're on your own.
Yeah, SOL.
Wow.
This is all things you don't have to worry about in traditional Medicare. This is why when Medicare was founded in the 60s, it was urged to be passed by labor unions, Martin Luther King, the president, organizations, because you can go anywhere in America. Any doctor that wanted federal reimbursement had to accept you no matter what your color of your skin or your income level was. They had to treat people equally. It wasn't considered equity. It was considered equal access to medical care. Everyone had to have that same equal access. Medicare provides equal access. Medicare Advantage does not. And so to me, and I keep saying this, it creates haves and have-nots. If you're a low-income retiree, you will not be able to access those doctors that you want to, or the ones in these specialty hospitals or clinics, because you don't have the means to pay them in advance.
So now I'm thinking, this 3-year contract they just got with Sloan Kettering, is this going to be a real cancer care, or is it going, what you call it, clinic care, or what? Because
So they are considered in network with Memorial Sloan Kettering for 3 years. That's just in network. That means that Aetna will work with MSK, MSK will work with Aetna for 3 years for payments. You don't have to do pre-visit confirmations. Aetna and MSK basically will handle all your prior authorizations for those first 3 years. But that's not to say that they're going to stay that way. Memorial Sloan Kettering at the end of that 3 years could say, I've had enough of this shit, I'm out of here.
yeah, exactly.
Remember, even the contract with Aetna, the EOC, states that your care with any vendor in the network is predicated upon the contract being renewed, including the Aetna transit contract.
And see, it goes back to prove that they're not putting the information out for the people that need to have it. It's like this guy said, you need an application for this continuity of care. You put out a flyer about it, but what about the details? What about the details that says, okay, now you got to fill out an application for it, and it's only good for a year?
Yeah, see, even the ESA, what does PPO ESA mean? The Aetna Medicare PPO plan has an extended service area. This means that Aetna may extend enrollment in your plan, even if you live outside the Aetna network. It allows you to see any licensed provider who is eligible to receive payment from an original Medicare and accepts the plan. If the doctor doesn't accept the plan, you're still in the same situation.
Exactly.
So-
Let's see.
I just looked at the rest of this letter that I got from Aetna.
Okay.
How to find a network provider. Below are network providers in your area. So that's my area because this has my Delaware address. So in the back of that same letter is telling me it's two names, two doctors, only two doctors that are in network here.
How far are they from you?
But wait a minute. They got 718 numbers. This is a 302. This is 71. I don't understand this letter. If you need help finding a network provider, call us or visit us. But then you're saying how to find a network provider. Below are network providers in your area. 718-369. I'm not in 718. I'm in 302. So this is a confusing letter here.
It wants
You
you to
call-
call the 718.
Yeah.
Hold on, what's the phone number? 718.
Let's say
718.
call them, see where they at.
369-7226. Ask Gary, Ramin. That's his name.
718-369-7226.
Yes.
That's the Park Slope Women's Shelter.
What?
Wait a minute, Marianne. 718-369-7226.
Is that the number that's on your letter?
Yes.
Hold on. 718.
369-7226.
Not
Thank you
answering.
for calling Canvas Park Slope Women's Shelter located at 14028 8th Avenue. If you know your party's
Holy
expense.
shit. A
Shelter.
Wait, let me call the other number.
That's the
52.
Park Slope Women's Shelter.
All right, there's another number.
Go
Let's
ahead.
call-
You gonna dial that one?
I got it. Where is this? Department of Medicine for hospital or just?
Yes, this is the administrative team for the Department of Medicine at Methodist Hospital.
Okay, thank you. That's the
Mhm.
Methodist Hospital.
One's the women's shelter and one's Methodist.
Wait, so that's Methodist in Brooklyn?
Yeah, if it's 718, yeah.
Wow. So you don't have no providers in your area. That's what they telling
No,
you.
well, as to this letter, they say they're in my area.
But the letter
Well,
was mailed to where?
Middletown, Delaware.
That's one big area. How they go from Delaware to Brooklyn? That's
Yeah, this is real scary, man. And now you see this, Blunt, that this
Yeah,
is
I
how
see.
real this shit is, man.
is
So
depressing.
you got this letter that says that your doctor will no longer be in the network,
Yeah, absolutely.
and the doctor that you were seeing is a Brooklyn doctor?
Yes.
And so they're trying to refer you to some other Brooklyn doctor is what they're trying to do, or the women's shelter,
I mean,
which makes sense, I guess.
No, I don't have anything.
Way to go, Aetna.
no, but do they know? They obviously know that you're in Delaware.
Yeah, they do. Because even the guy, Derek, I have you in Delaware.
Maybe you should ask them if there's anybody in the network that's by you where you're currently at. Because maybe they think that you're just using that address, but you're,
If my medical card came here, my new Aetna card came here, everything that Transit comes here. They know this is my primary address. Secondly, that's a big screw up by having the women's shelter on the back of one of your letters as a medical provider.
Yeah, like that's not even it's not even the same realm. That sucks.
Was the
bro.
doctor that's out of network? Is it a GYN or?
She just said she was a medical provider for Methodist. I guess she was the answering service for them. The second number I called. Okay.
Methodist is a couple of blocks away from the women's shelter.
Yeah, okay, because they don't call it Methodist anymore. They call it New York Presbyterian now.
Mm.
Yeah.
Right.
And the doctor that's on that letter was in the vicinity of these two places?
She answered Methodist Hospital. So
No. I'm saying the doctor that's on the letter that you would be affected by if the contract wasn't renewed.
She works in the hospital there. No, well,
But she
office is downtown Brooklyn, but it's New York Presbyterian.
Affiliate.
So they have little offices all over the place.
Right. They affiliate. She's affiliated with Methodist.
She's affiliated, right?
Mm.
She was a Mount Sinai doctor, but she left Mount Sinai and went to New York Presbyterian. And I don't
Okay.
know if Mount Sinai takes Medicare Advantage now. I don't know.
Mount Sinai's in the same situation with another plan. I think we're having the same issue with Mount Sinai and United Healthcare. Whether or not they take Aetna Medicare Advantage, I'd have to go back and look.
Yeah. I'm dealing with them now, but I have regular traditional Medicare, so I don't think.
Okay.
Don't
right.
change.
I don't have any choice. That's all I can get.
Don't change. So does that answer kind of your question?
Yes, it does. It does.
Yeah. Make
So-
sure you update your team.
Okay. I'll do that. Appreciate you again, Marianne. I didn't
Welcome.
cry this time because one of the guys called me and said, Lloyd, you crying like a little bitch on the.
No, you're just sentimental.
I got sentimental about this just because of this crap here, it's scary. First
It's a
of all,
lot.
scary.
It's a lot. It is. It's
So-
scary.
It's heavy.
Yeah.
It's heavy. You could say it. It's heavy.
It
But-
is. It's heavy.
You had to see Blunt's face too when you said my wife. I have so many new husbands now. It's awesome.
He
I was
was
like,
cracking.
what happened? Yeah, that was nice. That was nice. You
I
guys
got
played
lots
that
of
off real
husbands
well.
now. So but it makes it funny because they'll hear the honey, what you asking?
Right?
I can see them squirming. Oh my God. I feel sorry for Lloyd.
See you guys later on. All right, Marianne. Thank you.
All right.
Love you guys. Ciao.
All right. Talk to you later.
Bye.
All right.
Bye.